Zones and points of active damage. Rehabilitation by points. I want to remind and warn all sane people that a strong, uncontrolled impact on zones and points, especially in a situation of necessary defense, can lead to irreparable consequences, serious injuries and death of a person. Responsibility will follow. Defeating vital points in martial arts is still a well-hidden or lost technique. For a long time, reflexologists have known 365 main biologically active points. Zones and points of active human injury are the most vulnerable, weak and easily accessible places on the human body for forceful influence. The main areas of active lesion are the face, head, neck, limb joints, arms and legs, heart area, pubic and inguinal areas, perineum, spine. 1. The most vulnerable points of the head. Dangerous consequences. A blow to the temple. The temple is one of the weak points of the skull. The artery of the meninges runs deep under the temple. The average thickness of the skull is 5 mm, in the thickest place its thickness is 1 cm. In the temple area the thickness of the skull is only 1 to 2 mm. A blow to this area can lead to concussion, loss of consciousness and death. A blow to the base of the skull. The point is located at the base of the skull, at the junction of the occiput and the first cervical vertebra. A weak blow to this area leads to loss of consciousness, a strong blow interrupts the nerve and leads to immediate death. A blow to the top of the head. The point is located on the top of the head. This is a rather weak point of the skull. A weak blow to this point can cause a concussion. A strong blow can damage the brain, cause hemorrhage and, ultimately, death. A blow to the back of the head. This point is located in the center of the back of the skull at the junction of several bones and feels like a slightly elongated structure. This depression is the weak point of the head. With a weak blow to this point, a concussion and loss of consciousness occur. If the blow is strong, it can lead to hemorrhage and death. A blow to the brow arch. These points are located above the eyebrows. Blood vessels and nerves pass through these areas. A blow of medium force can damage them and cause hemorrhage in the eyes and loss of consciousness. A blow to the lower jaw. This point is located at the angle of the jaw below the place where it connects to the ear. A blow to this area breaks the bone into small pieces. This area is also known as the knockout zone, because a side kick aimed at it hits the cervical spine, which causes the opponent to fall. This is one of the reasons why in real combat fighters often lower their chin to cover their lower jaw. A blow to the nasal bone. This point is located on the nasal bone, between the eyebrows. The nasal bone is thick from above and thinning downwards. In the center there is a small vein that goes into the nasal cavity. A blow to this area can easily damage the nasal bone and lead to severe bleeding and difficulty breathing. In addition, a blow to the nose is very painful and impairs vision. A blow on the cheek, above the side of the jaw, this point is relatively weak. A blow to it leads to a fracture of the jaw and damage to the surrounding blood vessels and nerves. If the opponent's mouth is open and the blow is struck at a downward angle, the jaw falls out of the joint, causing severe pain. A blow or a slap on the ears. There are many blood vessels and nerves near the ears. A blow to the ears leads to damage to the outer ear and eardrum. 2. The most vulnerable points of the neck. A sharp blow to the back of the head. This point is located next to the third cervical vertebra. A weak blow to it causes displacement of the vertebrae, which as a result exert pressure on the spinal cord. A medium-strength blow knocks out an opponent and can lead to serious complications. A strong blow that interrupts the nerves of the spine leads to immediate death. Chopping blow to the throat, thyroid cartilage. The thyroid cartilage, colloquially, Adam's apple, is surrounded by numerous blood vessels and nerves, and behind it is the thyroid gland. A blow to the throat leads to severe pain and loss of the ability to breathe. If the opponent's head is thrown back when hitting, the result of the blow will be much stronger. 3. The most vulnerable points of the trunk. A blow to the sternum, solar plexus. The sternum is located in the center of the body. In this area is the heart, below the liver and stomach, xiphoid process area. There is no protection in the form of edges. Consequently, a blow to this area directly affects the heart, diaphragm and nerves between the ribs. A blow to the solar plexus causes severe pain in the walls of the stomach, difficulty breathing. The opponent loses the ability to defend himself. A strong blow can lead to bleeding into the stomach, heart failure, rupture of the liver, internal bleeding, loss of consciousness and, in some cases, even death. A blow between two ribs. Usually blows are applied to the 7th, 8th and 9th ribs and the cartilages connecting them. On the left is the heart area, on the right is the liver. The ribs from the 5th to the 8th are the most curved, and they are the easiest to break, especially where the bones connect to the cartilage. A strong blow to this area can lead to a heart attack, liver damage, internal bleeding and possibly death. A blow to the movable ribs. Movable ribs are located in the lower part of the chest. These are the 11th and 12th edges. They are not attached to the sternum. Since the ribs are not fixed in front, the impact will lead to their fracture inwards. This, in turn, can lead to their penetration into the liver or spleen, which is deadly. Impact or recoil by pressing on the armpit. Many blood vessels and nerves pass through this area. In addition, this recess has no protection from either muscles or bones. Exposure to this area with the fingers can cause a sensation similar to an electric shock, and a temporary loss of motor ability of the hand. Strong pressure can lead to damage to nerves and blood vessels, difficulty in hand movement. A kick or a hand on the pubic bone. This area is very sensitive. Hitting it is quite painful and leads to the inability of the opponent to continue resisting. Kick or hand in the crotch. Many nerves pass through this point, and the genitals and bladder are located above. A weak blow to this area will cause very severe pain. A strong blow can lead to rupture of the bladder and cause shock. Kick or hand on the coccyx. In this area, the nerves are relatively protected, and a strong blow can damage the central nervous system, causing severe pain and possible paralysis. A blow to the kidneys. The kidneys are located very close to the back wall of the abdominal cavity. From an anatomical point of view, the kidneys do not have protection in the form of ribs and are very vulnerable. Upon impact, there is severe pain, possible rupture of the kidneys, profuse bleeding. A blow to the back area located opposite the heart. A blow to this point can cause shock, as there is a direct effect on the heart. Such exposure can be fatal. 4. The most vulnerable points of the legs. A blow under the kneecap. A blow to this area causes severe pain. The greatest effectiveness is achieved when attacking the supporting limb, on which the body weight is concentrated. The result of such an impact will be damage to the tissues under the fibula and tibia. A blow to the outside of the knee. This effect will cause the joint to move in an unnatural direction, bending inward, and will lead to damage to the ligaments, as well as to a rupture between the bones of the joint. In addition, a strong blow can damage the main fibular nerve, causing severe pain. A blow to the inside of the knee. This effect will cause the leg to bend outward, damage the ligaments and tendons around the kneecap. The best angle for striking is a sharp downward angle in the direction of the side back. A kick in the leg. A blow to the joint, metatarsal and tarsus of the foot, crushes weak bones. Damage to the Achilles tendon is a serious injury that threatens to lose balance, stability. Under the supervision of an experienced instructor, the impact on the zones and points of active damage should be regularly practiced in practical classes, training relaxation in order to feel and control, and not to maim and kill. Rehabilitation by points. Assistance in emergency situations is provided by active points. It is best to use the second phalanx of the index finger, when it is bent, of the right hand or the tip of the nail phalanx of the thumb of the same right hand. In case of fainting, seizure. 1. Pressure, light pressure, under the nasal septum. Massaging in a spiral, it is better to use the nail phalanx of the thumb of the right hand. 2 foot, compression of the earlobes, short and strong, with the tip of the nail phalanx of the thumb and the third phalanx of the index finger of the right hand. When the breathing stops. 1. Intensive massaging of the point in the center of the sole, in the pit between the second and third metatarsal bones. 2. Massage the point located at the level of the midline of the fourth intercostal joint, the level of the nipples on the chest. In case of loss of consciousness. 1. Active acupressure of the crown of the head, an exception, it is forbidden to do it with traumatic brain injuries. 2. Using a needle. By means of a short tingling, with a well-clamped needle between the thumb and index finger, its tip itself, from the tip of the nose, to the top of the head along the middle line at a distance of a centimeter from the point of impact. State of shock. 1 foot, acupressure of the center of the tip of the nose. 2 foot, massage the inner side of the forearm over the proximal bend of the wrist, the point in the center of the forearm.